Okay, so this is for knee proprioception. So this would be post-operative, maybe either knee replacement, or it would be like meniscal surgery, ACL surgery, that kind of thing. So standing, I'm wrapping one in behind the back of the other knee, and then working into, this is called end range extension for us. So it is important, it's important movement for joint position sense, so particularly post-surgery or post-knee injury, where balance receptors get affected and joint position sense gets affected. This movement here is important because when we're walking, when our heel hits the ground, we need control in this last inner range of 20 degrees of extension, where our quads has to be really good at stabilizing our knee as our body weight passes over that fixed foot when we're walking. So, so this is just a small little movement here where I'm locking back into my knee and then bending. And so you would cue that the person would think about pulling their kneecap up towards the front of their hip, so tightening through their thigh, pressing the knee back into the band. That's the idea. The band behind the back of the knee is giving proprioceptive feedback. So the person has something to aim for. So they're pushing their knee back in towards the band, pulling their kneecap up towards the front of their hip, feeling the tension in their quad, holding it for 3 seconds and relaxing. And then separately you would do it as a movement where they go in and out and in and out, progressing then to doing that with their eyes closed. So glutes are working. The foot position is such that the weight, the arch of the foot is up off the ground, you're in a nice neutral position, and you're extending back and bending. Further progression beyond having the eyes closed would involve having the other foot up off the ground. So it's a single leg version, pushing back into the resistance of the band there, and relaxing. Okay, so separate to that then, we also work a bit in post-operative knees. We work with tracking, so this would be applicable to hips as well. So we send the knees out, and you could pick up a little bit of tension in through the band, so that you have a taut band at either side, and you're cueing the person to bend into their knees, sending their knees out over their toes and coming back up, and that they keep their knees just where the outside of the knee is touching off the band. So patients will deviate into this sort of a pattern where they have knee or hip issues, and we're trying to keep the knee out over the middle toe. So the idea is they want to brush the outside of their leg off the band as they go out and then as they come back in. And then that's movement number 1, which is kneecaps forwards towards the toes and back in. And movement 2 is where they keep the band to the outside of their knees and they reach their hips back into a bit of a hip hinge movement like that. So the tibias stay vertical, the hips go back, and this is a posterior chain exercise for the glutes and hamstrings, but when they're doing it, they are keeping their knees in this position, so not allowing them to come in. So it's giving proprioceptive feedback for the joint. Okay.